I forgot to record earlier.
Oh, okay. We can always go back and redo the slides at the end too if you want to include that information.
It's on Facebook.
Oh, perfect. Okay. And so we're focusing on the importance of getting vaccinated when you're pregnant, and I think the flip side of, or the safety of getting vaccinated when pregnant, I think the flip side of it is thinking about the risks of getting COVID while you're pregnant. And so something to highlight is that, as we mentioned in the very first slide, pregnant women who get COVID are at a much higher risk of developing really severe disease. So they can get really, really sick with COVID really fast. And that means that people who are pregnant who get COVID are 3 times more likely to need to be in the ICU, 2 to 3 times more likely to need a breathing tube, to have like respiratory failure and need to have a tube in their throat to help them breathe. They are at a slightly increased risk of dying because of COVID, and also people who are unvaccinated who get COVID may be at an increased risk of having a stillbirth or a preterm birth. Mallory, did you want to do some slides?
Sure, yeah. Does anyone have questions so far about any of that information or reflections? I know it's a pretty loaded topic and probably people have a lot of thoughts. So this feels like a good stopping point to pause if people want to talk.
سؤال يا قبو. Any questions? And how about Facebook? Jamila, anybody have questions?
No, I don't see any questions on Facebook.
Awesome. That means we're doing great.
Okay. So we will move to the next part, which is talking about getting the vaccine and then breastfeeding your baby, which I think a lot of moms and families have been wondering about. And so this is one of my favorite things to talk to people about, is that people who get pregnant and then have a baby and start breastfeeding, if they got the vaccine either after they had the baby or during their pregnancy, they are making antibodies, which are like little protective proteins that go through the breast milk, and then the baby is therefore protected from COVID. So it's this amazing tool that moms have that can help them protect their babies, which I think is really, really cool. And for a lot of people that I know has been very motivating, since babies are too young to get the vaccine, and since we know that babies are getting more sick from COVID. So I think this is a really important piece for families to talk about. Some worries that families have brought up to me are that they worry that the vaccine will decrease their milk supply. And this is not shown to be true in any of the data we've looked at. Something that I think people have a connection within their brain is if they don't feel well, so either if they have COVID or if they have some side effects the day after COVID, if they're not staying hydrated, then they might not be making as much milk if they're feeling sort of sick. But overall, it has no impact on the success of breastfeeding. And actually getting the virus can really impact breastfeeding success. And so the virus versus the vaccine can protect the baby, and you don't have long-term impacts on milk supply, which is awesome. Next slide would be great, Heather, thank you. So COVID vaccination in babies, this sort of goes back to what I was saying about most babies are too young to get vaccinated. The CDC is recommending vaccination in kids above the age of 12 and up. And so for those of you who have kids that cross all the age spans, you can protect your babies by breastfeeding, and then you can protect anyone above the age of 12 through having them get the vaccine too, which I think is really important to consider now with the Delta variant that is more contagious and more dangerous for younger kids. Let me see. Any studies done on babies born with moms who have had the COVID vaccine? Good question, Taylor. So the thing that we're doing is monitoring. So moms who get pregnant or are pregnant know that they're pregnant when they have the vaccine. There's a vaccine reporting system. And so we're always collecting data on people collecting data from people who have gotten the vaccine. And so if anyone has any concerns about either themselves or their baby after they've gotten the vaccination, then they're reporting this to this, it's called the VAERS, VAERS, Vaccine Adverse Event Reporting System, I think is the abbreviation. Heather can correct me if I'm wrong. And so they're sort of self-reporting if they have any negative impacts or if they've noticed anything on their baby. And so through that system, there has not been any trends that we've noticed that the babies have been impacted adversely or impacted in a negative way from the vaccine. Really good question. Does that answer your question, Taylor? Awesome. Okay.
I also just want to add to that we do know that the vaccine in moms gives a ton of antibodies to baby as well. And so hi, I'm Maya. Sorry, I was running a little bit late today. Sorry to join late. But yeah, they have done studies and it shows that like babies are getting some of the antibodies from mom and therefore are getting the protection from being in the womb during vaccination as well as from breastfeeding, which I know you've already covered.
Thanks, Maya. We're happy that you're here.
Good to see you, Maya.
Okay, next slide is talking about some of the common vaccine side effects. So these I think of as being similar to other vaccines. So we get vaccines for a lot of things, and the side effects from COVID vaccines and other vaccines are similar. A lot of people from personal experience and from what my patients have taught me is you get a really sore arm, and that's like for most people is the most uncomfortable part. And usually that gets better within 48 hours. Some people can get a little fatigued or have a headache, can have muscle pains throughout their body. Sometimes people are getting chills. I had a little low-grade fever with mine that went away after about 12 hours, and then some nausea. I don't know, Maya and Heather, did you guys, with your vaccine, did you have any of these side effects?
I had a lot of fatigue, but it worked out perfectly because I got both vaccines the day before I switched to night shift. So it allowed me to sleep all throughout the day before my night shift. Often people have a little bit stronger of side effects after their second dose. And that's very common and not unusual.
I felt like I had kind of a mild flu. So I had a headache, I was tired, I had a low-grade fever, but it lasted less than 24 hours. And I woke up the next day and felt like totally better.
Yeah, I think that is a common experience. So to be expected, if you get the vaccine and you have those things, you don't need to panic. You can just plan to sort of rest at home and take care of yourself, have your partners, your husbands, your kids bring you stuff, and let yourself sort of just rest up. Yeah, next slide, Heather, thank you. After you get the vaccine, so here are some good tips. Anytime you're feeling some sort of pain on your arm, you can put a cool wet washcloth over the area or take a nice hot steam shower. Most important thing is not to stop using your arm. So the instinct is to keep your arm still if it hurts. And so I tell people not to do that, avoid that instinct. So to keep the arm moving, do these like little light circles with your arm after you get the vaccine. And that sort of helps keep blood flow to the area and will make it more comfortable long-term. And then staying super hydrated, wearing lots of layers if you get hot and cold, so that you can take off a layer if you need to. Maya, do you wanna, I think I just did well, I'll do this one and then you can maybe jump in after that. I know you just hopped on. Okay. So I'll then sort of switch focus to this new Delta variant that I'm sure people have heard about. It is concerning for several reasons. The main thing that we've noticed is that people are tending to get more sick and it's more contagious than the other variants of the virus. And so I guess just to step back a little bit, when we think about variants of a virus, basically that happens if the virus is allowed to replicate or reproduce in people's bodies. So it's like the virus is having a ton of little babies, and each baby is a little bit different than the last baby. No babies are exactly the same. And I think about the Delta variant as being a product of a ton of babies growing in people who haven't gotten the vaccine. And so the Delta variant is spread easier, so it's more contagious. It makes people more sick. We have noticed that kids are getting more sick with the Delta variant. And then I think the rest of these are sort of self-explanatory. The good thing on this side is if you're fully vaccinated and you get the Delta variant, you still are protected. So the vaccines that we have right now still work against the Delta variant. So even though it is scary, it's reassuring that the vaccines are still useful.
I think, like we were saying earlier, the Delta variant is a little bit more contagious. And so that's why you've seen a lot more people wearing masks again, and like some mask mandates coming back. Just trying to, even if you're fully vaccinated, reduce the spread of this more contagious variant. Maybe we should pause for questions between our next transition between Mallory and Maya. If anyone has any questions, or on the Facebook page, if there's any questions.
So Ali Aqaba, you guys have any questions so far?
Yes, I just have a follow-up question with something that was asked earlier. It's for the in the babies, how long does immunity last after they're born?
Good question. I will look into it a little bit more, but I think the main thing is, so if mom got vaccinated in pregnancy and continues to breastfeed after delivery, then as long as the mom still has antibodies and protection from the vaccine, which like I got vaccinated months ago and I'm still making antibodies. So like you make antibodies long after you get the vaccine, then you're still giving those antibodies to the baby. And so as long as you're breastfeeding, you're still protecting the baby. But I can look and see if there's any more information for babies who are born to moms who got the vaccine in pregnancy but don't continue to breastfeed, because I'm not sure if we have that data.
Thank you.
Yeah.
Babies are not required to, well, actually, no, they're not yet. Okay, I see. Okay, sorry.
And for the like the 12-year-old age mark, how did they determine that? I mean, I'm sure it has a lot to do with like the immunology of kids or whatever, but what are they basing that on, like that marker for kids for not getting the vaccine?
Yeah, so they base it on the studies that they did. So especially for Pfizer, all the initial studies were 16 and above, and for Moderna, all the studies were 18 and above. That's just who they included in the studies to ensure that it was safe and effective. And then once they finished those studies and it was approved for adults, they then were also doing studies, and the next group of studies were the 12 to 16 group. And so that's who they included. And right now we know that there's studies going on with younger school-aged children, and the hopes is that by the next month or two, it's going to be approved for younger kids. But kind of they were using more of like a risk-averse model of testing on adults, testing on people who are adolescent, closer to adults. And it is related, a bit to their developing immune system, but it was also more related to like, it's also a lot easier to do studies on adults. There's fewer hoops you have to jump through because, children are a protected class, just like pregnant people are a protected class in studies. And so it's really hard to get approval. And so it was only after they demonstrated that it was safe for adults were they able to do the studies on children.
And I'm not sure if this is something that you have access to, but when they're determining that age, like that marker, are they looking at like how the vaccine affects them physically? Like is there something happening physically that kids older are able to handle versus like 12 and below that age group?
I don't have the answers to that because I'm not running the study, but I anticipate is that the 12 and above was an easier group to study first because their home return more similar to adults.
Yeah.
And kind of once again making sure it's demonstrated safe on older people before going younger and younger. But like I know I have a close friend whose 1-year-old has gotten the vaccine because they're part of a study. And so I know they are studying on younger kids, but the bar to prove safety is high on everyone, but it's often higher on children. And so it takes also longer to do those studies.
Got it. Thank you.
And Maya, I'll add one other thing. I think too, when we think about studying the ethics of doing a study, we're really careful to make sure we're doing things in an ethical way. And so enrolling people in a study who aren't able to consent to being in the study, or who aren't able to say the pros and cons, like that's really hard to do for kids who are younger than the age of 12 because their frontal lobes aren't developed. And so I think we started with adults because adults are able to fully consent to being in a study. And then I think another thing, just like knowing all of the young people in my life, like people under the age of 12, it's a little bit harder for them to describe symptoms that they're having. And so I think from a like, if you get the vaccine and want to know how people are feeling afterwards and want to know the long-term implications, like that's harder to do in younger people who have a harder time like expressing some of their side effects. And so I think that's why we started with older people and then 12 and up. And I think it's sort of an ambiguous number. At some point we have to choose a cutoff.
That's what I was wondering. So like an arbitrary number to kind of just say, okay, this is, wow. Okay. Thank you.
Yep. I think one other thing that came to my mind is that there was such a limited number of vaccines in the beginning of the pandemic, and we knew that adults were getting COVID more frequently and getting sicker, and children weren't getting as ill. And so I wonder if that was a factor too, even though that's changed now with the Delta variant, like we're seeing kids get sick.
Sorry, I didn't hear that. Can you repeat that?
Yeah,
Oh,
Heather, you're quite soft.
Yeah.
Can you hear me better now?
Yes.
Okay. These headphones are getting a little old, I think. I just said one other thing that came to my mind, aside from the safety things, which Maya and Mallory described so eloquently, was that I think in the beginning of the pandemic, there was such limited resources for the vaccines that probably focusing on the older age groups that we were seeing people get sick more frequently and more severely made sense at that time. And with the Delta variant, we were seeing children get sick earlier, but earlier on in the pandemic, when they're kind of making these decisions and deciding who needed the vaccine first and making those tiers of who gets the vaccine in what order, children just weren't getting as sick too. So that was probably part of it.
Yeah.
And I know I looked just really briefly while we were chatting, and it looks like they haven't studied like the immunity that babies have after they're born to a mother who had the COVID vaccine specifically, but in general, when mothers are vaccinated and they make antibodies, and then those antibodies go through the placenta to the baby, it looks like it lasts like several weeks, up to like a month to 2 months. So it's a short amount of time, but can be really effective. And then just like Mallory and Maya were saying, moms also produce antibodies in the breast milk, and that helps protect them too. But it's the same idea as the Tdap vaccine, the tetanus, diphtheria, and pertussis vaccine that we encourage women to get in their last trimester, that protects the baby from whooping cough because of that same mechanism of producing antibodies.
So when does mom require to receive the shot? Like in how many months, how many weeks?
We now say at any gestational age. Originally they were saying after 20 weeks, but they've done more research and they really say like when you can get it is a good time to get it, because we are also seeing just that pregnant people get so much sicker when they do have COVID. So getting it as soon as you can. And also just being aware that we know that the vaccine does not cause miscarriage. Like it is not related to it at all. However, miscarriage in the first trimester is common. And so I think sometimes it can be really hard for people if they were going to have a miscarriage anyway and didn't know it, they got the vaccine, that might blame themselves, thinking that it was related to the vaccine, although it's not. And so sometimes people will choose to do it in the second trimester because miscarriage in general is less likely, and they're less likely to associate anything or have any self-blame, but really at any trimester. And then I also just wanted to add one more point to the 12 and up thing that physiologically, if you notice in almost most medicines, it says like, this is the dosage for children and this is the dosage for 12 and up. because 12-year-olds bodies are closer to the weights of adults bodies. And I know that's something that they're figuring out in the kids studies that they're doing now, is what is the appropriate dose to give kids at different ages. And so one of the reasons it's easier to do a study of 12 and up is they can almost always use the adults dosage and not have to figure out the dosage that's appropriate for that age.
And does mom who is pregnant require booster shot as well?
At this point, they are not saying so, but that may change in the next few weeks as they're having more discussions about the booster shot. But right now, it's still just the 2 doses.
Maya, do you want to jump in on these?
Sure.
Cool.
And so kind of one of the challenges is the COVID vaccine is really getting it to all different groups that need it. And there's a lot of reasons that some people haven't been getting the vaccines. And a lot of those kind of fall along the mistrust that people have in the medical system, because the way that our medical system has treated people of different races and treated people of different economics backgrounds or ethnic backgrounds or religious backgrounds. And I know we've mentioned that in the past when discussing how the healthcare system has failed groups, and it's because of those failures in the past, a lot of people mistrust it. And so that has reduced people getting the vaccine. Other issues is access from their job. Like if the vaccines were only being offered during business hours or certain hours at pharmacies and people work during those hours, it can be really hard to get there. Lack of transportation or lack of being able to take a day off if they feel really fatigued after the shot. And so there have been some challenges. And so different organizations have been trying to work to address those disparities and gaps to ensure that everyone has the same access to the vaccine and is able to get it. And so in looking throughout the United States, looking at who's been the most vaccinated and had at least 1 dose kind of from March until August of this past year, we've seen that primarily people of Asian and European descent have had more access and been able to get the vaccine more often than people who are Hispanic or Black. And that's something that we're need to close that gap to ensure that everyone is as protected as possible from the Delta variant and then future variants that may come. So kind of in summary of everything that was discussed, we are recommending the vaccine for everyone 12 years and up, including people who are pregnant, including people who are breastfeeding, trying to get pregnant or may become pregnant in the future. I've had several patients who are pregnant get the vaccine and been great. I've had several patients who got the vaccine and then got pregnant. And then evidence has shown that it's very safe to do during pregnancy. The evidence is continuing to grow as more and more people get vaccinated. And that really the benefits of being able to have those antibodies during pregnancy and passing those on to your infant really outweigh the risks. And there's no evidence of the COVID vaccines causing any fertility issues in anyone. And I know that's been a rumor that's been going around a lot, especially on social media. And I know that it's because they think that the part of the spike protein looks similar to a protein in the placenta, and they're worried that it might attack the placenta, but there's no evidence even in any study that that's true. And the amount of proteins that look kind of similar to other proteins throughout the body is a lot. And so the fact that 2 kind of look alike is not important. And then we also know that people who are pregnant or recently pregnant get much more severely ill with COVID-19. And we've been seeing that within our own hospital. And we've been seeing like pregnant people get very sick. And I know in the Seattle area, pregnant people have died because of COVID because they were unvaccinated. And they're having to do like C-sections on people who are intubated, and it's really traumatizing. And so we really recommend the COVID vaccine for everyone. Jamila, that's a wonderful question. I think the pregnancy group is they're encouraging everyone who's become pregnant and gotten the vaccine during pregnancy to like register that they have. But I don't know I'll try to look into that to see what the exact numbers are on those studies to make sure that it's actually representative. Oh, Mallory's looking into it right now. Okay. And then some common myths that you may have heard on the news or on social media or people on YouTube. The vaccine does not make you magnetic. It does not have a chip in it. It does not track you in any ways. It does not have any ingredients that can cause an electromagnetic field at the site of the injection. There's no metals at all in the vaccine. It's impressive the things people will come up with. Asia, you were wondering if the vaccine can cause back pain. Not typically, but sometimes you'll have muscle pain, especially the day after or a couple days after, similar to if you get the flu, you can have those muscle pains. And so if you're having back pains for a couple of days, that could be related to those muscle pains. But in terms of long-term back pain, it's I've not seen any evidence that that causes it. And then I'll finish, I think we have one more slide and then we'll get to the rest of the questions because I want to make sure that we're getting those done as well. These are the ingredients in all of the vaccines. The three ones that are approved in the US are the 2 mRNA ones, which are the more common ones, and then the Johnson & Johnson, also known as the Janssen. And looking through these, they have a lot of, there's a lot of words that, are hard to pronounce and that can sometimes be really scary. But most of the words in here are like cholesterol, which you have in your body. Sodium chloride is table salt. Acetic acid is vinegar. Sucrose is a form of sugar. And the other ones are like, they're super long because they explain in the name of the molecule kind of where the different hydrogen bonds and different other bonds are on the molecule. But they're very transparent about what's in the vaccines. It's very clear. It's they're trying to make it very transparent to make people less scared of getting it.
Does it have a pork? Because some of our believe if a vaccine has a certain element from pork, we can't have them.
I don't believe so, but we can double check.
Not in Pfizer. Let me double check for the others though.
Okay.
Yeah.
There are no animal products, I believe, in any of them.
No animal product. Okay. I got السؤال قبل إن محيرة هذا عن حالة هاي COVID vaccine كل جودة واحد كجير مالها محيرة هذا عن pork كم جيران إن مركز سؤال قليا قبل.
Yeah, the CDC says that there's no gelatin, either the Pfizer or the Moderna, and that's often where pork sneaks its way into things.
Yeah.
Yeah, I think there's no animal products or in any of them. That's what I've heard.
Yeah, that's good to know because I have been asked a lot and several people in the community. As a matter of fact, today I was asked, I don't want to take it because I don't know if it has a pork in it. And I'm like, I'm going to find out for you today.
Yeah. On the CDC website, it specifically, there's a spot where it says none of them have any gelatin, which is often the way that pork is. So I can share that specific link if that would be helpful to you to share with your friends.
That's wonderful. Yeah. And how long is baby protected after it's born, like immunity wise? And I know you answered this question earlier. I kind of forgot.
We don't know exactly, but not for a really long time, like weeks to months. Like weeks to 2 months, I think was the upper limit that I saw. But if mothers have been vaccinated and they breastfeed, that breast milk contains antibodies that continue to protect the baby. Even after the antibodies that they previously had in their body have sort of faded, that breast milk with antibodies will continue to protect them for as long as they're breastfeeding.
And is mom required to have like a second dose after giving birth? Like a booster shot? No.
just as if it's a 2-dose series, then they should complete the series. Like if they got one at 35 weeks of pregnancy and then they wanted to get the other one after, then they should just complete the series as of now. But there might be a booster coming down the pipeline in the future.
How about the flu shot and the COVID? Can mom take both during pregnancy? So
Yes, and they're both encouraged.
the flu shot, that, and also the
Tdap.
Yeah.
yeah, 3 of them. Oh, moms, I'm gonna hate you guys.
I know, but I think they hate us more for, you know, cervical exams and other things that happen during pregnancy as well. Pregnancy is it's a tough time sometimes.
It is.
It's a wonderful time, but tough.
Somebody put a question here. Let me see. There we go.
That's a really good question. I am not, the question was, are there laws that cover women who do not want to get the vaccine while pregnant? I am not sure. I know there's certain states, including the state of Washington, who's requiring all healthcare employees and requiring all government employees to be fully vaccinated by October. And I don't know if there's exemptions for pregnant people. I am less aware of some of the legal aspects of that, because that I very fortunately did not go to law school. But
You went to
sorry.
med school though.
I went to med school. I found interesting.
Yeah.
For the legal protections, is that about like being able to work or go to school or be in places that are requiring vaccination and sort of have like an exemption for that? Was that the question?
I forgot the question.
Yes, for work. Okay. Yeah, I also did not go to law school, and but I have not heard of any special protection or exclusion of getting the vaccine for pregnant women.
But as of right now, it's just to encourage, not requirement.
I think it depends on
Exactly.
your workplace, though. I know that there are some workplaces that are requiring it.
So the state of Washington is going to require all healthcare providers and workers to be vaccinated by, I believe it's October 18th. And I don't know if there's other, that's a law, but I don't know if there's other, proclamation, but I don't know about other places of employment.
Ouch.
Hey, Heather. To answer the question about the representation of different races in the pregnancy study, can you just open that link that I sent to the chat and then go to page 3?
Okay, just a second.
Sorry.
Oh, no.
I like that.
It does work. Okay, there we go. My computer's just like kind of slow, you guys. I'm sorry.
You're looking for how many demographic got
Yeah.
shot? That's
Yeah,
good.
so to the question about if the pregnancy test group was diverse and inclusive, this table I think highlights it pretty well. So this is from data from December to May, and you can see under the total population column, race and ethnicity, and you can see how many people that got the vaccine were included. And so there definitely were white folks were the most represented in the study. Can everyone see that okay? Yeah,
24%.
Mm-hmm. And then 32% were Hispanic or Latino, 14% Asian, and then 7% Black. So not great, but still, I think I think that's what we have to work on, is like, this is people who were getting the vaccine. And so we know that there are inequities in the way the vaccine's being distributed and the patients who are getting the vaccine. And so the data is more reflective of the 34% of people who were white and the 32% of people who were Hispanic or Latino. So we have some work to do to make sure it's more inclusive.
Yeah, we have work to do. 7% for Blacks.
Mm-hmm.
That's not acceptable.
Mm-mm.
What do you think are the barriers of why people are like not being tested at the same rate?
So I guess I'll just clarify too, this chart is for people who have gotten the vaccine. And so it to date has been voluntary. And so I think for a lot of reasons, like a lot of historical reasons, people of color are more hesitant to be in trials for vaccines. And so I don't know if anybody has any other thoughts about that, but I think it's because our system has not been very kind or equitable to people of color.
Of course, the history speaks itself.
Yeah.
Yeah, that's a huge component of it. And also kind of, as we had a slide a little bit about this, that often to get the vaccine, you need to go somewhere during business hours and have a more flexible schedule sometimes. And so it can be harder to take time off of work to go get the vaccine. And some offices were providing vaccines to the workers, but a lot of them weren't. Or being able to take a day off of work if you're not feeling well and feeling like you can't take the time off work and don't want to feel sick for a day. And so there's a lot of hesitation. There's a lot of mistrust, and there's also a lot of like, where were people getting the vaccines first? Who was able to get them? And who had the means to like drive an hour or two to get a vaccine before they were readily available, and who couldn't because they were working or had other responsibilities. And so there was an issue of access, there's an issue of, job, there's an issue of mistrust, and all of those kind of compound upon each other to contribute to these continued disparities.
And it goes on and on and on and on and on. Yeah. Well, for those of us who work in the community that advocates on behalf of our people, have a lot of work to do to go out there and to check this information. And that's why I chose to go Facebook Live today, because, so people can have this information, and to see the myth and in what comes with it. So hopefully this will open somewhat doors for those of us who,
I realized we didn't go through some of the myths as well that are more efficient. COVID does not cause infertility. I know we kind of talked about that a couple of times, but I know that that's one that's very popular online that I've read on different people's social medias, and there's no evidence.
In 2 more years, within 2 years, you're going to die. That's another myth. I don't know where they get that.
Oh, I haven't heard that one, but also not true. Although, we can't predict the future. You may be hit by a train. That's unrelated to the COVID vaccine.
That's what I say. You can die anytime. It has nothing got to do with COVID.
Yeah.
I mean.
And then the next one is COVID. You can't get COVID from the vaccine. So the vaccine is not a live vaccine, which means it does not have live virus in it. Certain vaccines do, like the chickenpox vaccine and the MMR vaccine. So those we, tell people to avoid if they're currently pregnant, which is why we don't give those 2 vaccines to pregnant people or if they're immunocompromised. But the COVID vaccine does not have any live virus. So there's no way in any scientific way that you can get COVID from the vaccine. It's not physically possible. You also won't be shedding any COVID virus after the vaccine because that's only happens in very specific live vaccines, which the COVID vaccine is not that type of vaccine. So if you care for someone who's immunocompromised, you can still get the vaccine, and I would say highly encourage it.
Makes sense.
And
back of that off that, Maya, is the people in your lives, if you're pregnant, the people in your life, or you know people who are pregnant, the people in your life should get vaccinated too, because you can only do so much. You can only get vaccinated and give the antibodies through your breast milk and through the placenta. Like, people around you should also, like you said at the beginning, like, this is not just for moms, it's for more people. And so you guys are here to protect each other. So definitely encouraging moms, but encouraging people who will be around babies too. Sorry, Maya.
very well said. Thank you. And so kind of people often wonder, well, how does the vaccine work? And it's basically, especially the mRNA vaccines, which are the Pfizer and the Moderna, we'll focus on that because that's the most common ones in this country. Basically, it has mRNA is like a blueprint. And so the vaccine is a blueprint, and it shows the blueprint to your immune cells of what the spike protein, which is the little protein on top of the coronavirus. The reason it's called coronavirus is because the spikes look like a crown, and corona is crown in a language that I don't remember. And so it shows a blueprint of the M spike protein, and it causes your cells to make a couple copies of that protein. And then your immune cells recognize those spikes as saying, oh gosh, those aren't human proteins. Those aren't coming from in the body. Those must be a foreign object that we need to learn how to attack. And so it teaches your immune system to attack the spikes that are on the outside of the coronavirus. And so that way, if you're ever exposed to the coronavirus or COVID, it attacks the spikes, which are on the outside. And so it prevents the virus from being able to get into your cells because the spikes are being attacked. And so it works by, showing that blueprint and then having those blueprints make that protein that then teaches your immune cells. And so there's no live virus at all. There's no, it's really just the blueprint, and that blueprint, the mRNA, is gone from your body within 72 hours. And so nothing really remains of the vaccine except the knowledge that your immune cells now have on how to fight.
Makes sense. It makes sense.
Right, doctor. Sorry.
No, go ahead, Zainab. I was just going to ask some silly question.
Yeah, no, just to follow up on that one. So I noticed that when you get the second dose, like your body reacts more because it's obviously like, recognizing that there's some foreign, something in your body. But does that, you said it's to recognize that, but when you get the virus itself, does it kind of like only affect you the first 72 hours like the second dose would, or does that take longer in your body? I don't know if that question makes sense, but I'm just interested in knowing how that works.
I don't think I fully understood the question. And I just want to make sure, are you wondering, how long does the virus, if you were to get infected again, stay inside your body? Or was
not so much stay inside your butt, but how much more would it affect you? Like, is it gonna hit you the hardest for like the second dose that you got the vaccine, like how your body reacted, or is that gonna affect you stronger when you get the virus? I know it depends on each person differently, but
yeah. So because, so you're wondering, how does your body react when you actually see the virus?
Yes.
Based on how your body had reacted to the first and second dose. So we know that it almost always causes fewer fewer symptoms than if you were to get COVID without it. And that's because especially these vaccines are targeting the outside of the virus. And the virus causes symptoms once it gets inside your cells, and then they replicate inside your cells, and then they burst the cells open, and then there's a lot more virus, and they keep infecting more and more cells. And that's why you have so many symptoms from COVID. And then it's also due to your immune system trying to fight the virus. Because the vaccine teaches your immune system to make antibodies to the outside proteins, those antibodies block the proteins, and so the virus can't get inside of your cell. And the side of your cells. So it can't replicate, it can't make more viruses as easily. And so you have much less virus floating in your body. And so often you have almost none. So your physical symptoms that you would have if you were to get COVID after being vaccinated is much lower because those antibodies are already fighting against the COVID virus and are preventing the COVID virus from infecting your human cells.
I love that explanation. Thank you so much. So it's kind of like a stranger knocking on your door and you lock the door, they can't come in. Like that's what.
Yeah, it's like,
Yeah. Mhm.
I like to think of the mRNA vaccines are like those wanted signs from the
Yes.
Wild West movies.
Yeah.
Basically, it's showing a wanted sign to immune cells, being like, see this guy? If you see him, you attack. Those signs said like reward dead or alive, but these signs just say like this virus, you see it dead, like you attack it with your antibodies, pew pew pew. And so it teaches your cells to know what it looks like to be able to fight it immediately. Whereas if you get infected with something new, it takes a little while for your body to learn how to fight it. But with the vaccine, your body already knows how to fight it.
So the mRNA messengers are like bounty hunters, basically.
Yeah.
Yeah.
Exactly. They're the picture that the bounty hunters have, saying this
Right.
guy.
Oh my
Gotcha.
God.
Thank you so much.
Good. That's a good explanation. Oh my God, I like that one. Bounty hunters. I thought about SpongeBob, but then in it as well. Yeah, let me stop. You're a parent when you do SpongeBob. Oh my God. Okay, that's good. Any questions, ladies? How are we doing, Facebook, Jamila?
No questions. Yeah.
That's good. That means people are streaming and they're just watching it and they're just taking it in, which is really good message. How about you, ladies? Gabdo ya su'ala qabo ku jira halkanito. I'm waiting. I had one silly question, but I forgot when you guys were talking about bounty hunters and SpongeBob's, but I forgot. Yeah. It's always nice to have fun, guys. Yeah. Well, that was nice. So what do you guys think about next month? What should we talk? قبله إذا كاكو جرتين next month محن كهلنا دقاتيرت محن وصل صار يعني. What do you guys think? حليمو, you have any question about your سؤال ما قبته؟ وما قشموه.
I remember last month you had people had expressed wanting to have a session on like what to expect in the first trimester of just like a regular average pregnancy, and then have another session on the second trimester, and then another session on the third trimester.
You knew about series of like the whole entire pregnancy, then go through the whole entire postpartum breastfeeding. Yep, maybe it's time for us to start that. Yeah, what to expect, this time I'm gonna write it down because I keep forgetting it.
Fair. I've been telling Jasmine and Amelia, who are the ones who organize these sessions on our ends, what you guys had been asking, so they're aware too.
So you guys wrote it down, what to expect first trimester of the pregnancy. And Zainab, did you wrote it down too?
No, I did not, but I will.
Okay, because Zainab is my PR person. She always asks me, she says, what's going on? I'm like, okay, I don't know yet. So there we go. I like that. And then we can start that series, and then second trimester, third, and then, delivery, and we can go from there, hopefully. Hey, stop talking to me. Now you know I don't like to go Facebook Live, you guys. Maybe it's time for me to log off on Facebook and then come back to you.
I just fixed my spelling on the first page because I realized it was spelled wrong.
Yeah, so I'm off Facebook Live, and I just want to thank you guys so much. I know it's Saturday, and I will see you guys next month.
Bye.
Thank you so much.
It was good seeing you all. Sorry that I was running late today, but I'll see you again next month.
No.
Thank you guys. Thank you so much, Doctor.
Seeing you guys.
This was so fun. Thanks for all of your amazing questions. This was such a good
Yes,
discussion.
Definitely. Thank you so
Very
much. And you guys
thoughtful.
answer. I reviewed the questions Faiza sent it, but before I even read it to you guys already answered it. I'm like, yes.
Good.
Got it. Thank you, ladies.
Thank you so much. Bye.
And
Have a
so
great
did you
day.
want Did you want for the recording, did you want us to just like show the beginning slides really quickly, or do you feel like the Facebook Live was enough?
That'd
Okay.
be great. Actually, I'm still recording. Yeah, definitely.
Okay. We can just like breeze through these just so people can like see and
I
pause
will
if
put
they
it
want.
on my page.
Yeah. So these
Visual
are just the first few slides that we had that just had some basic information about COVID and all these major bodies of doctors and researchers that recommend pregnant women to get vaccinated. Talked about how it's safe for people trying to have a baby to get to the COVID vaccine at any time. We talked about how vaccines affect pregnant women briefly and how it's very safe. How many people so far have gotten the vaccine that are pregnant, and Mallory showed that like great breakdown of people that shows that though there's been a lot of people, several stadiums full and 75 cruise ships full of people, that it's only 7% of those identified as Black or African American, and so not fully equitable research or data yet.
Yeah.
And then COVID's really dangerous when you're pregnant. Just kind of talking about the complications that can happen. We talked about how it's safe to get the vaccine when you're breastfeeding and can help provide immunity through the antibodies through breast milk for baby. How right now the CDC has said that babies under the age of, or children under the age of 12, they don't recommend vaccination, but that will likely change in the future. We talked about the reasons why. And important for people around babies to get vaccinated. We talked about common side effects, tips for after the vaccine. I think at this point we were recording. We might have made it through.
I think so.
Cool. Awesome. It was really nice to meet you, Squad.
It was nice meeting you guys, and I'll see you next month. Thank you, ladies.
Thank you.
Thank you.
Bye, guys.